The patient is positioned in lateral decubitous position and asked to arch the back as much as possible. Ideally, the hips and the shoulders are squared to the bed. The back is then sterilely prepped with betadine and draped in such a fashion. Ideally, the drape is placed so you can still palpate the iliac crest and remain sterile. This is a lumbar puncture tray that has been set up with the sterile tubes already upright. We're now drawing back some 1% lidocaine for local anesthesia. The local anesthesia is then used to numb up the skin and underlying soft tissue. We have localized the L2 to 3 interspace between the two fingers, and we are now numbing up deeper soft tissue using a longer needle. Of course, as you advance the needle, you always want to aspirate to assure that you are not in a blood vessel prior to injection of the lidocaine. A spinal needle is now inserted. In adults, you can usually feel a pop or loss of resistance when the dura has been punctured. At this point, the stylet is removed and you should have return of clear spinal fluid. A manometer can be applied to measure the opening pressure, which is determined when the spinal fluid starts oscillating in the manometer. The manometer is now removed and spinal fluid is collected in all of the 4 sterile vials. The spinal fluid will then be sent off for culture, gram stain, cell count, glucose, protein, and any other special studies. After collecting the spinal fluid, a stylet is replaced, which minimizes the risk of a spinal headache following the procedure. And then the entire unit with the stylet and needle are withdrawn from the skin. A sterile band-aid is then applied, and then the drape is removed, and the procedure is then complete.